What are the side effects that you can expect if you are thinking about taking metformin? That is what we are going to talk about today. Hello and welcome to my channel. My name is Dr. Megan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you are confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. So today I'm talking about side effects with metformin. So I made a video about metformin and how it can be used for help with weight. And of course, it's not the strongest weight medication and it can be a little bit inconsistent, but for the right person, it can be extremely helpful. Now, metformin, I've heard a lot of chatter on social media and in the news about metformin. I think it's having a moment in terms of like longevity. Metformin can have a lot of side effects. None of these medications are to be taken casually, but I think the level of discourse around metformin on social media is such that I think a lot of people feel like, oh, everybody should be on metformin, and metformin has a lot of side effects. So that's what we're going to talk about today because some people are pretty miserable on metformin. So this is all just to say, if you are thinking about metformin, it can be a great fit for some people, but definitely you want to have a thoughtful conversation with your prescribing physician about whether it is the right medication for you. So, just to back up just a little bit, metformin is used off-label for help with weight. So essentially, it was used before the GLP-1 medications came around. It was used a lot in terms of preventing or helping to reduce medication-associated weight gain. So if somebody was on an antipsychotic or Paxil or some of these medications that can be very weight-promoting, their doctor might also co-prescribe metformin or prescribe it later to help with that weight gain or kind of reduce their BMI while they were taking it. But it can also be used as an add-on to augment weight loss if somebody's already on another medication. But for me, it's certainly not the go-to round one draft pick for weight loss for somebody if there are so many other great options available. So there are some really significant side effects with metformin. Rarely is the side effect of lactic acidosis, which is essentially a buildup of lactic acid in the body. That is very rare. It can be life-threatening, extremely serious. You're predisposed if you have significant kidney disease, if you're on certain medications. For people who are in the hospital who are undergoing imaging studies with contrast, that can be a risk. Other, predisposing factors would be, congestive heart failure, liver disease, but rare, but good to know about that lactic acidosis is a potential side effect. Also a risk if you're over 65. Also, there is a risk of B12 deficiency. So for anybody who's taking metformin, it's always good to take a B12 supplement. Talk to your doctor about that. And then really what happens with metformin, what I hear about all the time, is the GI side effects. So a lot of people have diarrhea. A lot of people have nausea. A lot of people just may have some reflux or just don't feel very good. They may have some gas. A lot of times there's this kind of initiation period with metformin where, it's really bad in the beginning, but then if you push through, your body gets kind of used to it and then it goes away. And for some people, it doesn't go away. So for those people, it may be worth trying an extended release metformin. And it's always good to take metformin with meals because this can potentially decrease the side effects as well. And again, because of how metformin works, and I made a whole other video about that, there's always the, theoretical risk of hypoglycemia. Because it is decreasing the amount of sugar that is released into the bloodstream. That's really more of a theoretical risk for people who are not diabetic. So, but good to be aware of. So those are the risks of metformin. Not a medication to be taken casually like any of these medications, but certainly can be a great tool for the right persons. So that's going to do it for today. I hope this was helpful. If you have questions, you can definitely leave in the comment section down below. If you want to work with me directly, I will leave that info in the comment section down below. Thank you so much for watching, and please be well.